Hi, I am Dr. Adam Lin. I'm a cancer doctor specialized in seeing patients with blood cancers here at Northwestern Memorial Hospital in the Robert H. Lurie Cancer Center. Also, I am a research scientist or physician scientist working on designing extremely small nano-sized materials to treat blood cancers.
Well, I like solving problems, coming up with an idea or a solution, and proving that I was right about what I think was supposed to happen. That kind of a high, that feeling is priceless. So, physician scientists are a special type of doctor who sees and treats patients in the hospital, and during that time, we discover problems and questions regarding our patients. We take those questions and we bring them into the laboratory, like where I'm sitting now, and come up with possible solutions. Then we take those solutions that work and bring it back to the clinic to help the people that need it.
So let's use an example in a special type of blood cancer called Hodgkin's lymphoma. The cancer cells built a little fort for themselves to protect them from being naturally killed off by your body. The doctors notice that there are these armed immune cells that come right up to the fort or the cancer cell but just can't get in. That's actually quite smart for the cancer, right? So the doctors took the fort to the laboratory and analyzed every aspect of it. Eventually, they found that there's these drawbridges on these forts. So they used a special drug that lowered the drawbridges, and guess what? Now the armed immune cells can enter the fort and kill off the bad cancer cells. How exciting. So then the doctors took this finding, did a clinical trial to test how these drugs work in real life human patients, and it worked really, really well. This started a revolution of immunotherapies. So this is what bedside to bench and then bench to bedside looks like.
Quick side track that I think is quite important. During this whole time, there were so many moments where I felt that I couldn't make it. I'm not smart enough to be a doctor or a scientist, and there's absolutely no way I can do both. What am I doing with my life? And this some people call this imposter syndrome. I think some of you watching this video probably think the same thing. For where you're sitting now, you might feel like there's no way I could be in STEM. I'm not smart enough. I don't have the resources. I don't think I would have made it this far on being a cancer doctor and a cancer researcher if it wasn't for the support of many people who believed in me, gave me opportunities when I reached out to them. So I think the key here is to don't be afraid to reach out to any of us. Cold emails can be completely fine. You don't lose anything by sending an email, but if someone does respond and willing to mentor and help you get into STEM, that's a huge win for you. That being said, I have many, many, many people to thank to get to where I am. Sometimes way too many to count.
So I make these really, really small things to treat cancer. How small are nanoparticles? Well, if you imagine that you are the size of a cancer cell, which is around 10 microns, and the bacteria is the size of a 6-inch sub. A virus, like the coronavirus, is about the size of a peanut butter cup. And a nanoparticle is then the size of an M&M. We can make different colors, flavors, textures of M&Ms to modulate how your eating habits are and also to modulate how the cells do different things. Cancer cells can eat thousands and thousands of these M&Ms or nanoparticles, as you see as these bright spots on this image. Pretty cool, right?
My favorite thing about my field are the people. Hands down, the people. First are my patients. I love helping patients feel better, but connecting with patients in such a deep level is a very special feeling. I get to know them, I get to know their stories, their families, and a lot of amazing stories. I even wrote a little bit about it. Second is working with some amazing people. Medicine is a team sport. In the hospital, I work with nurses, nurse practitioners, physician's assistants, social workers, various type of therapists, and of course, other doctors. In science, it's also a team sport. We have postdocs, grad students, undergraduate students, technicians, We all work together to make the impossible possible. And importantly, we have fun doing it. So in the morning, I go to the hospital, I see patients there working with a great team that helps me do the actual work uh, and collaborate together. Our patients have a great view in Chicago. They get to see the lake sometimes in our infusion center. What we do is a pretty cool procedure called stem cell transplantation. What we do is we give a patient with blood cancer, like leukemia, for example, a lot of toxic drugs to wipe out the cancer and wipe out their bone marrow. Their bone marrow is a factory that makes all the blood cells. Uh, then we take a healthy person's bone marrow, the factory, and then we give it to the patient. These donor cells finds that area, finds the factory, and then populates it with its own workers, and voila, the patient now has a completely different person's blood and immune system, and no more cancer. For lunch, I get to hang out with some of my friends. We eat lunch around the hospital, and of course, we complain about our day. That's what we do. Then I head up to a laboratory to work with some really cool friends that have really brilliant ideas on how we can make different drugs and different particles to help treat patients with blood cancer. And our goal, again, is to see if we can one day bring it back to patients and treat them. Well, that's my story. I'm a physician scientist that treats lymphoma and performs stem cell transplantation. And I'm also a nano engineer. Come join me. It's super fun and super exciting.